Okay. I'm going to be given gentamicin 80 milligrams IV piggyback every 8 hours. I have my label down here and I've worked out my drug problem, and we are giving it drops per minute, and I will be given 13 drops per minute. I'm going to come to my MAR. I have the same patient, John Smith. His birthday is 3/23/91. He has no known allergies, and on his MAR it states to give 80 milligrams IV piggyback of gentamicin every 8 hours. So that'll be 13 drops per minute. Okay, and I'm going to come to the book. Gentamicin is an antibacterial drug. It should be given 3 milligrams per kilogram, divided into 3 doses, so every 8 hours, and that is a safe dose. It is available in premix concentrations. It is compatible with normal saline or D5. So we have D5 running, and it will be diluted with the mixture pharmacy sends. You administer each dose over 30 to 60 minutes. So we're going to be going over 60 minutes to be on the safe side. Some contraindications: if they have a gentamicin allergy, renal failure, or a sulfite sensitivity, it might be a contraindication. Some precautions: sensitivity studies indicate to determine susceptibility of causative organism to gentamicin. Use extreme caution if therapy is required over 7 to 10 days. Monitor the range between toxic and therapeutic levels. I've already checked their therapeutic level this morning and it was therapeutic. You want to monitor their renal function also. Some side effects that can occur is anorexia, burning, dizziness, fever, headache, hypertension, hypotension, itching, or lethargy. So now I'm going to go and prepare my medicine. So I have gentamicin, 80 milligrams IV piggyback. I'm going to look at it, inspect it. There's no cracking or anything. The expiration date is June of 2021, so it is in date. Now I'm going to fill out my drug label. Gentamicin. 80 milligrams. Given on September 23rd at 10:10 a.m. The expiration date is June of 2021. Patient John Smith. Room number 402. Start time is at 10. Start date 13 drops per minute in D5W. Alright, so I have my medicine and I'm about to go into my patient's room. I'll do hand hygiene. Gloves. Alcohol swabs. This in my mark. So I'm gonna put this over here. Good morning, Mr. Smith. I'm gonna be your nurse today, and I'm gonna give you some gentamicin for your infection. Can you tell me your name and date of birth? He tells me John Smith. His birthday is 3/23/91. So he's the right patient. Do you have any allergies, Mr. Smith? He doesn't have any allergies, so I'm gonna take a look at this IV site. It looks good. Check for blood return. Let me get good blood return. Okay. So now I'm gonna go check my medicine one more time. I'm giving gentamicin 80 milligrams to John Smith. He has no allergies, and this is prepared correctly in the right solution, and it is compatible with D5. Let me make sure this is clamped before we begin. I'll clamp that off. Now I'm going to make sure this solution is hanging below it. So I'm going to connect this to the port closest. Make sure it is clean for 30 seconds. Now I'm going to connect it. Make sure that doesn't touch anything.
Okay, so I'm doing an IV push.
There we go.
I got my doctor's order and my mark. So I'm looking for my patient's name,
Okay.
my patient's
So now I'm going to open
my patient's allergies,
this
and
up.
I'm looking at the order and it says I'm going to
Make sure all of this is
20 milligrams IV push every 8 hours. And
Now I'm going to be
and
getting
20 milligrams is a
13 drops a minute, so I'm going to count for 15 seconds
I'm
first.
going to be looking at my rate. It says that I can push it in over 1 to 2 minutes, but I'm going to be doing 2 just to be on the safe side. And it says it might be given undiluted, so I don't have to dilute this. And I'm also looking at my my fluid that is infusing. That's D5, and just looking at dilution compatibility. This is compatible to frozen outlet. Okay, and another thing I will be letting my patient know, prior to giving this medication, I'm going to be monitoring for potassium, I'm going to be monitoring for blood pressure, and I'm going to keep a constant check on their electrolytes, their CBC and liver functions. And some of the things I will warn my patient about is to please call me prior to ambulation when they feel the urge to urinate. Also, to let me know if they start feeling dizzy. Okay. Why?
I don't know. I know I
Delete it.
Let me see.
Delete that.
Okay, I'm gonna start my minute now. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13. Okay, so we have our drop rate of 13, and we would let that run for the complete hour. So I would assess him, make sure he's doing okay, he's not having an allergic reaction. I would ask him, are you feeling okay? And tell him to let us know if he starts feeling funny, dizziness, or lightheadedness. Then after 60 minutes, I would come back in there. It would be complete, so I would clamp this off. Okay, so I have this clamped. I need to clamp my primary. Alright, now I'm going to unhook this. Take this down. Rehang your primary. And I would set it back to what it was set on. Okay, the IV looks good. Do you have any questions, Mr. Smith? Let us know if you need anything or you start feeling funny. I would continue to monitor him after that. Okay? And I would dispose of all my equipment. Did I hit everything?